Hello everyone, my name is Anuj. I'm finally an MBBS student at GMC Nagpur, and in this video I'll be telling you about what's in my bag as a finally MA student in India. And I actually made a similar video in the past, and I think that needs a major update right about now. So let us start with the tools for clinical examination. So first of all, as you might all be knowing, this is a stethoscope and I've had this since first year. It was actually gifted to me by somebody, and this is a Microtone classic stethoscope. It's very good for beginners. It's very cost friendly. Currently priced at I guess 650 or 750. We basically use the stethoscope to auscultate different parts of the body, and it's one of the most important things that you should have as a medical student, especially once your clinical rotation start. Going to the clinic without a stethoscope is considered sort of like a crime, so don't commit that crime. Get a normal stethoscope and go ahead and auscultate a lot of different things. Just by auscultation we can find out so many different things about the cardiorespiratory system as well as the GIT. As far as the sound quality is concerned, I think that you can hear pretty decently from it. It's not a Littmann stethoscope, that's for sure, but I'm sure with enough training you will be able to pick up almost all the sounds from this stethoscope as well. To be very honest, you don't actually require stethoscope in first year. You actually start to require it from the second year of MBBS when the clinical rotations start. The next most important thing for the clinical examination is this thing. This is called as the hammer. As you can see, we've got a tapering side and we've got a broad and a flat side. So we basically use this hammer to test the central nervous system of any patient that we have. One of the classical examples is the knee jerk. So you tap the knee through the L4 L5 segment of the spinal cord. What will happen is your quadriceps muscle will contract and your hamstrings will relax. So your leg will swing like this. And by looking at the reflexes, we are able to tell if there is a lesion, because different types of lesion could cause increase in reflexes or areflexia. This is the portion which we use to elicit touch sensation as well as certain signs. One of the most important signs is the Babinski sign, which is something seen in upper motor neuron lesions. So if this is the foot of the patient, we take this and we do something like this. And normally what would happen is that your thumb would come together. If there's a lesion in your central nervous system which is of upper motor neuron type, your great toe, it goes back and your fingers fan out. So that is a positive Babinski sign showing that there is some kind of upper motor neuron lesion present. One more thing which you can do from this hammer is that you can take this tip off like so. It will reveal a brush. So this brush is sort of used to see the fine touch, the fine sensation that one has, and we use it to check whether the dorsal column of the spinal cord is intact. So yeah, this is the brush. You can also open the hammer from this segment and it shows that it's got a sharp tip over here. So as you can see, this is a sharp tip that we've got over this end, and this basically is used to elicit pain sensations where you sort of poke this thing in the skin and see if the patient has any sort of reaction to the pain. It is also very useful during CNS examination. We can estimate the gas glaucoma scale from this and so many different things. This hammer costs around 65 rupees. So this is something which you all should have, because you're going to read about CNS and reflexes from first year, and if you're in the hostel you can just take this hammer and go to someone and try to do the reflexes on them if you're not going to the hospital. So yes, that was all about the hammer. The next thing is this. This is an inch tape. So this is simple Taylor जैसा tape है ये, और कुछ नहीं है. We use it to take the measurements. This is very important during the pediatric postings. So you have to take different measurements in babies to know whether they are healthy, whether they are growing properly, what is their current height for age, weight for age, and whether they are undernourished or not. So this is the tape which we use to take different measurements, and few measurements are head circumference, chest circumference, mid upper arm circumference. We can also take the length using this. If you don't have an infantometer, just put two books like this and then just use this tape to take one sort of measurement. This is also very important during our medicine postings, because there also the measurements are important, and sometimes during clinical examination, some cases we have to calculate the span of different organs. So the liver span, the heart span, you can do that using percussion and palpation, and then you can use the tape to take the span. This is usually the most forgotten item, because almost everybody forgets to bring this. I guess one or two people in a unit will have this tape, and that will get circulated to the entire batch. Try to buy this if you don't have one. I don't remember the cost of this, but it is also again very important. The next thing is the torch. You're going to use it a lot in ophthalmology, because you have to elicit the direct and the indirect pupillary reflexes using this torchlight. It will also help you examine the oral cavity, the buccal mucosa, if you are posted in ENT or in medicine. And yes, having a torch is definitely very recommended, because since it sends parallel rays of light, there is a lot less chance of you to miss something that is present as compared to your phone light, which will most likely send out diffuse rays. If you go to the medicine or the ophthalm posting without a torch, they will probably kick you out. So torch especially important during ophthalm and ENT. So what the direct light reflects is if you shine my light on one pupil, right? So that pupil immediately constricts, and and what the indirect light reflects is that if you shine the light on this pupil will also constrict. So that shows us there is an interconnection through the Edinger-Westphal nucleus where the parasympathetic ganglions release the acetylcholine and cause the muscle to contract. Am I getting too much in detail? So those were the key things that we have in clinical examination. One more highlight that I would like to tell you is we have got the gloves. So gloves are also very, very important during clinical examination. You don't want to, touch the patient without the gloves. And I don't ever carry gloves because in our hospital setting, we just take it from the nurses and do the clinical examination. Last thing, sanitizer, super duper important. I have a Dettol sanitizer. As you can see, I just use this because that's the one I have. Honestly, almost all the sanitizers work in the same principle. We've got alcohol as a composition over here, which is bactericidal. Please make sure to, sanitize your hands every time after you come out of the clinical posting, before you eat something or before you even shake your hand with someone, because from the ward you might be carrying very, very resistant organisms outside. So yeah, hand sanitizer is super duper must. You should definitely have this in the pocket of your apron so that you can immediately wash your hands after you're done examining. Long time back, I took a case and then I did not wash my hands. I was about to eat something when my friend called me up and said, "Jo case tumne liya hai, usko scabies hai." From that point onwards, I have always used a hand sanitizer every single time that I've touched a patient, and I think that's a pretty good habit. You should do that as well. Lastly, special mention is a dissection box. So I don't currently have my dissection box because that is something which we use in first year MBBS, and it is the best feeling. I remember, before first year dissection starts, I was very excited to, get my hands onto a dissection box. So it contains plain forceps, tooth forceps, and a few other scissors as well. We take that box to a dissection hall, we dissect a cadaver or a dead body from it, and we learn a lot of different things from anatomy. Those were the essentials for clinical examination that an MBBS student should have, must have every single time before you enter a ward, and these are fairly cheap. You can buy all of this within 1000 rupees, the most expensive being the stethoscope. So yeah, that's all about it. Right, moving on, the next thing is the apron. As you can see, I'm wearing it. It's kind of damaged. I've got a torn pocket over here. But that's honestly okay. I don't think I need to go into much detail. I just will let you know there are two categories in it. One is this one, which is, kind of like a t-shirt, small one. So traditionally the long ones are called as lab coats, and this one is traditionally called as an apron. So yeah, that was all about it. You have to buy the apron from first year MBBS. So when you're in first year, you're over enthusiastic and you want to wear the apron, you want to go out and you want to have fun. Don't do that. Don't ever wear an apron outside of your house. Don't ever wear an apron outside of a clinic, and don't wear it outside of your lectures. I just wore it because in the morning I was in the posting and I also wanted to film this segment. At least you should have two aprons because, you don't want to be overusing the same one over and over again. It will get pretty bad very, very soon and it won't start to look good. The next thing is this. This is called as a scrub, and we also call it as the OT dress. We use it whenever we are posted in surgical departments, for example surgery, obs gynae, ophthalm, ENT. So whenever there is an OT, we go ahead and wear this and go to the OT. These have to be autoclaved and sterilized and washed very, very properly before you go ahead. I'm just wearing this for the sake of the video. After this I'll put it out for washing because I don't want it to get contaminated. Key logic of using a separate dress while entering the OT is so that we could keep the sanitation barrier intact, so that the person who is being operated upon, who is already putting his body so much stress, is more vulnerable to get infected. So we use very, very clean clothes before we enter the OT. We also have OT chappals. So these chappals are the ones which you don't have to wear anywhere but the operation theatre. I honestly do not want to wash them, so I did not take them out. Before you go into the OT, make sure that you have an OT chappal, this scrubs, a cap and a mask. So I've got this cap as well for the sake of the video. Yeah, sure. That is kind of how I look when I go inside the OT. An interesting story. So I went to the OT for the first time. I was wearing my normal apron and clothes. I went inside to the changing room. I changed out and I came out and kept my shoes over there. I wore the OT chappal and went to the OT. Spent 3 hours inside and came back. And later I realized my OT chappal OT mein reh gayi hai. So you will definitely go to the OT for the first time, and this is one common mistake that you will definitely make. So please make sure कि जब तुम बाहर आ रहे हो OT chappal लेके आओ. Gladly I found it in the exact same position that I had left it the next day, and I got it back. So yeah, fun story. That's all. The masks that I use are usually N95 masks. Whenever you're going in the hospital setting, make sure that you wear a mask, and the reason is because you never know what kind of patients you're going to encounter. And I'm not trying to scare you or anything with being so clean or hygienic. It's something which is just so easy to practice, and it is one of the best ways you can prevent diseases. I guess every healthcare worker should also care about their own health. But whenever I go to the OT or special settings, they usually give us the masks which have been pre-sanitized, and they're only usable for one time, and then you can take the masks off. Now let's move on to the very interesting tech section which I have got over here. So please mind, first of all, I am also a content creator, so I have to carry a few other extra things which mostly no other person will carry. Second of all, I've bought all of this from my own money, which I've earned during the last 3 years of making content online consistently every single week. So before you go ahead and type a sad comment ki yaar iske paas itne paise hai, all of that, I've worked very hard for it. So yeah, let's get on with the tech section then. First one, I've got the iPhone 12 Pro, and this is the device which I've been continuously using since the last 1 year, and I think it's super duper awesome because well, it never ever lags out and the camera is just splendid. I've also made entire videos just shot on the iPhone, and I think this is a wonderful piece of equipment which is good at almost everything it does. So the configuration that I've got over here, so this device has 512 GB of storage. It's got 3 different cameras, and the reason for such high storage is because I am a content creator, so I usually shoot at 4K 30 FPS, and that takes up a lot of space really fast. But thankfully I haven't even once ran out of space in this device. The battery life that usually an iPhone gives you is usually 6 hours if you use it from the morning to the night, and my screen time usually stays at around 3.5 or 4 hours every day because I tend to not use my phone unless on the days that I'm actually filming. You can also see I've got this MagSafe wallet thing which I've attached over here. I used to keep my cards in this, but I just don't anymore because I don't know why, but I've still got it attached in case I ever need it. So yeah, that was about my iPhone 12 Pro. The next thing is my iPad Air 4 with the Magic Keyboard. I usually don't carry around the Magic Keyboard because the weight of the iPad is actually less than the keyboard, so I would much rather just carry this with an additional cover. I've got the Apple Pencil 2nd generation with it, which just snaps on. It's pretty good because I primarily use it to watch lectures or take notes, and I usually do that when I'm sitting in the library. Yeah, that was my use case for the iPad Air 4. The configuration is it's a 256 GB variant. It's iPad Air 4 with the Magic Keyboard. And the next thing is something which I consider to be the best investment I've ever done in my entire life. It was pretty expensive, but it's absolutely worth it. It is none other than AirPods Pro. I think these are the best sounding earphones ever. The active noise cancellation is something which I cannot actually describe unless and until you try it out yourself. And the battery life is around 4 to 5 hours without the case, and with the case it's around up to 1 day. But the thing is, they recharge very fast. So if I just put them down in the case for like 3 or 4 minutes, they'll recharge back up to 50-55%, and that gives me another 2 hours of playback. I again carry them only and only when I am going to watch some lectures while sitting in the library. And once you sit down in the library, put these on, pair up with the lecture, and turn on the active noise cancellation, you are teleported into a different world where nothing can ever distract you. I would highly recommend AirPods if you have enough money to spend that you have earned on your own, because otherwise you would just be putting too much financial pressure on your family for just a pair of earphones. But if you do have the money, this is the thing which I would definitely buy 10,000 times over because I love it. The next thing is also super important. This is a Xiaomi power bank of 10,000 milliampere hours. I use it occasionally to keep all the tech which I have charged up in case I am running low on battery. I almost always have this in my bag because you never know when you need it. And with that, I carry 2 cables. One is this USB to Lightning cable, and second is the old OnePlus 6 cable which I had, which is a normal USB-C type cable. This power bank costed me 999 rupees, and I think it's pretty worth it because 10,000 milliampere hour will charge your phone like 5 to 6 times. It will charge your iPad 2 times. So yeah, that is pretty good considering that it is very cheap. Next thing, like I said, I am a content creator. I have this small mini camera which I sometimes take to the college because when I want to take some shots like this one, this can get the job done pretty well. So this is the DJI Osmo Pocket 1, and it is very tiny. It is actually tinier than the palm of my hand. As you can see, this is the palm of my hand, and you can actually fit this in your pocket. So once you start this up, it kind of looks like this. And now as you can see, it is focused on me. So it is very tiny. It can do a lot of different things like taking video, photo, time lapse, motion lapse, hyperlapse, slow motion, and panorama. So this is great when I have to do all of these different shots which I just talked about, and I could very conveniently transfer all of these things to my iPad using this USB-C which they've got. I just flip the USB-C, put it like so, and connect my iPad right over here. So yeah, this was the DJI Osmo Pocket 1. The last thing which I've got which counts as tech is this beautiful speaker which my friends gifted me, and this is a Spider-Man themed speaker, and it's pretty. Whenever I'm in my car which does not have Bluetooth for some reason, I just use this as a speaker to play some music. It charges up with a micro USB, as well as it has got an SD card slot if you are into that kind of stuff. So yeah, very powerful, very cheap. I guess this is again around 800 to 900 rupees, but super duper happy with it. The last thing which I carry out as a content creator is this. This is a tripod stick. In this you can just go ahead and mount your phone, something like that, and you get a portable vlogging camera, and you can very easily take a lot of shots. You can just keep your phone like this or change the elevation and keep it somewhere like this. So yeah, this is another tripod which I'm sure I'm the only person in entire college who has one of these. So yeah, that's about it for the tech section. The next section is the books which I carry on a day-to-day basis. First of all, it completely depends on what kind of department I'm posted in. So let's say I'm posted in surgery, the book that I will definitely carry with me is this one. This is S. Das, which is like the gold standard book for practical surgery, and yeah, it's great. It's got different photos and everything. I read a few chapters from it when I was posted in surgery. So for any clinical department, wherever you are posted, you have to carry the clinical examination and different cases book for that particular department. The next up, I've got my case book, which I've talked about like 100 times on the channel before. I've written down all the cases which I see on a daily basis in my case notebook, and it's very easy to reference once I get the similar case in exam or in any post-end or something like that. Next thing is I've got another generic notebook which I use to take notes. So yeah, that's all I've got, and I usually carry one singular pen. I don't have more than one pen when I'm going to the hospital. Sometimes I also like to carry the Marrow notes of the subject that I'm posted in, so surgery, medicine, whatever. I just carry the Marrow notes, or sometimes not, because the reason is sometimes the network inside the college building is so pathetic that you are not even able to open the notes of Marrow, and you get pretty much stuck if you don't have a textbook at that point. I also like to carry around the water bottle, which I've got, again a generic water bottle, so don't worry about it. Lastly, my wallet. I usually don't have much cash lying around because I use UPI transaction almost all the time, but I'd like to show you something which I recently acquired. I don't know if many of you have seen this or not. It was certainly the first time that I was seeing it. So this is a 20 rupees coin. So I don't think I'm ever going to spend this one, so this is kind of the money which is blocked. So yeah, 20 rupees coin, pretty awesome. Let me know if they're being used commonly in your state, city, country. So that was it about what I carry every day to college. Some of it you might have found it to be very useful, some of it to be absolute nonsense, but I'd like to thank you very much for watching my video. If you did like it, please smash the like button on your way out, and also please subscribe to the channel, because making videos such as this one take up a huge time, effort, and energy to make, and subscribe in just 2 seconds will make up for all of that. Alright, thank you so much. It's Anuj. I'll catch you in the next one. Goodbye.